This is Gary Galante. Welcome to the first Pediatric Gastroenterology podcast, and this is a Hepatitis C primer designed to accompany the academic half day on treatment and management considerations of Hepatitis C in children. Now, this podcast is designed to deliver basic science regarding Hepatitis C. So I'm going to start by quickly talking about some of the pathobiology of the virus. Hepatitis C virus is a small virus and it's a member of the Flaviviridae family. It has a single-stranded RNA genome, which, as we will see, is eventually translated into a single polypeptide, which will then be cleaved by viral and host enzymes to a variety of proteins, which are not necessarily a part of the final product. These are called the non-structural proteins. The structural proteins, however, make up the basic structure of the virus, and you can see that the single-stranded RNA is enclosed within the nucleocapsid, which is a protein, as well as surrounded further by an envelope protein, which has two different types of glycoproteins, which we designate here as E1 and E2. Now let's look at how they use these proteins to replicate. First, the virus will bind to the host cell, which in this case is the hepatocyte, using its envelope glycoproteins, which will bind to specific will bind to specific receptors on the hepatocyte specific for these glycoproteins. Here you see that the virus is fused with the cell membrane, and the nucleocapsid will be what enters the cytoplasm. It is the uncoating of the nucleocapsid which will expose the viral genome, in this case the single-stranded RNA. The viral mRNA is translated to produce a polypeptide. Next, the polypeptide is cleaved by enzymes, beginning with a signalase in the host cell and continued by proteases, which themselves are the product of this cleavage. Another product of this cleavage, viral polymerase, will participate in the transcription of what is known as the negative strand RNA.